sort of get through a few more items so that we can then have our speaker. So Rochelle was going to get a t-shirt. She actually designed and has some t-shirts printed. Whoops, that's okay. Oh, there they are. Rochelle, go ahead.
Okay, so I'm a graphic designer, so that's what I do. But I wanted to do some t-shirts for this month, but then just to carry on through however many months that I partner with the Glossy Goat in Centralia, Missouri. I'm from Hallsville, Missouri. And so I partner with them. So as long as they can maintain the screen and they can produce them and people are ordering them, portion of the profits are going to go back to the coalition. So I have this posted on my webpage and my website for sale. And so tell everybody about them so that they will buy them. And the NFS, it's not for sale.
What's your website? And we'll type it into the chat box.
It's crowhaven.com, CROEHAVEN.com.
And that's NFS for not for sale. And then the barcode symbolizing how people are as commodities, but we don't want that. That's a not for sale, not the barcode.
Yeah, it says not for sale under the barcode. Great.
Okay, very good. And let's see. I guess Allison is not on. She's with the Attorney General's Anti-Trafficking Task Force. He's executive director. We hopefully will get an update from her at some point. I wanted to mention the other side of the illicit massage business, that there's some work to do outreach to create an opportunity for those who are victimized in even our Columbia and other illicit massage businesses all around the state and all around the country, to give them an opportunity not to be just moved about with their traffickers to another state, but perhaps to stay in the community where they have been and be able to work in a proper business, and to give them that training, that access. We know, language is an issue, but we're trying to get all of those resources in place so that we can offer them an alternative rather than being just carted off to another state, continuing the illicit massage business. And that means informally developing some relationships with the folks who are working in illicit massage businesses. So there's various steps to that. I just wanted to give you the general idea of trying to offer an alternative. If you can build those relationships so that there's maybe some trust and some friendship, that we can introduce the idea that there's an opportunity to not go with the business when it's been shut down and have to go up to another state. So, okay. And Loretta, this is Nanette Ward and Loretta, who is helping host this. And Loretta, you want to say more?
Sure. So I'm staff for the coalition. I do grant writing, I do resource management, fundraising, project, you name it. So I have a wide and varied skill set.
Yes. And what is it? It's like, and everything else is that one line, everything else is requested or desired,
yes,
something.
Everything else is requested.
Yes, something, yeah. So there's also this t-shirt, and human trafficking, and gives people an option. There's a couple different cool designs, and so we want you to know that that's something that had been ordered by some friends of ours in Camdenton who own a boutique, and they wanted to raise money for the coalition and design this t-shirt. So it's great to have different resources and initiatives and designs, because who doesn't want a t-shirt? And then also we wanted to just promote the monster crayons that were also designed by volunteer, and they were inspired by survivors who called their traffickers monsters. So she had crayons donated, melted down, and designed these monster crayons and the box, and they're being sold at another partner, Tin Roof Gifts, which is in Columbia. But you can also just let us know, because even though these were inspired by victims and survivors who call their traffickers monsters, really everyone has a monster. And we've had school teachers that bought them because kids have monsters, and you can kind of color away symbolically get rid of your monster with these crayons. So just wanted to let you know we still have those, and they're being sold at a store here locally in Columbia, but also we have them. Also, quick announcement so we can open things up for Megan. We did have a proclamation. Thank you to Audrey, connecting with the mayor of Jefferson City, Missouri, and the mayor of Columbia, Missouri. And they proclaimed January 11th, Human Trafficking Awareness Day for those two cities. And here's just a show and tell of our Columbia, Missouri, City of Columbia, Missouri proclamation. Also, the City of Columbia has a big keyhole that is at the entrance of City Hall, and it's been lit up blue for #WearBlueDay. The Department of Homeland Security has a blue campaign that's actually all year round, but for January 11th, Human Trafficking Awareness Day, we had joined on with the Wear Blue Day campaign. And so in honor of that, the keyhole has been lit up blue this week. And then we had on our Facebook, people were posting images of themselves wearing blue, and somebody was able to win a t-shirt for doing that. But it's not just one day, it's 365 days a year, just like even though we know about the Super Bowl, you know, survivors and victims will tell you, you know, I'm being trafficked 365 days a year. So it is important to focus in on these opportunities we have, but just being mindful all year round. January 26th, there is going to be a virtual event sponsored by Senator Brian Williams, along with other groups, including the Attorney General's Anti-Trafficking Task Force, or the Attorney General's office, and it will be, oh my gosh, it's January 26th. I want to say, I'm trying to put in my passcode on my phone. It's on our Facebook, so if you would go to our coalition's Facebook page and like and follow us, there will be several guest speakers. So we encourage you to sign up for that. There's a registration link that we've put on our Facebook page. We'll send it out by email as well, but it is free, and some great speakers on the panel that would be presenting that day. Let's see, it will be at 1 p.m. and Senator Jamila Nasheed, who has termed out, but she's from St. Louis. She introduced a Senate concurrent resolution that made January Missouri Sex Trafficking Awareness Month. So this will be the 6th annual event in recognition of that. We appreciate the work that she did as Senator of Missouri. I'm trying to get the speakers up. Karen. No, it's from 1 to 3 p.m. And there's an Eventbrite link that you can go to from our Facebook page that will let you register. There will be a panel discussion. Senate Sergeant Dan Nash with the Highway Patrol will be on there. Also a Johnson County, Missouri prosecutor, a victim advocate, Carolyn Schrag with Rise Coalition out of Joplin, Missouri, a sexual assault nurse examiner, program coordinator from Children's Mercy Hospital. I believe that's I'm not sure if it's St. Louis or Kansas City, but Heidi Olson is that panel speaker, and Russ Tuttle with Stop Trafficking Project, and he speaks to hundreds, thousands of children all around Missouri with his project doing prevention education. And then Christine McDonald, who is a survivor leader and advocate, will also be giving closing remarks. I did want to share with you the speakers. And then January 28th, the coalition in partnership with Forum 8 Theater, GQT Theaters, is hosting a documentary screening. It will be the first public showing of this documentary. There is, oh, and here's the trailer.
Let me share my screen. Let's see.
As if handing it to you will make things happen. Thank you.
When I was 12, we were hitchhiking from Idaho to Oregon, and a semi-driver had pulled over and picked us up. And that was the first time I was trafficked.
About a year after he began raping me, around the time that I was 4 years old, my father, he began to sell me to other men. And it began with an uncle.
Me being a kid, I was 12 and 13 years old. They never used the word prostitution, but that's what we're talking about.
14 is when I actually met the guy who would become my trafficker. I was trafficked while I was still at home, still going to school, still going through all those things. And so, like, that was my first time being sold.
I just want to give a thanks to Loretta, who we did not have a trailer for this film, but who put together a trailer for this to share with all of you. Thank you, Loretta. And we just want to invite all of you to come and come out to Columbia. Senator Person and Theta want to invite you all to come if you can, and all of you who are in traveling distance to join us. This this documentary will actually be shown on PBS in the future, but this will be the first public showing of this film. Actually, Misty, one of the females that you saw, lives in Missouri, and the acknowledgement at the end of the text, thanking the female law enforcement officers, I think that inspired this film. Basically, is what it was saying is the film producer Susan Cook knows Wendy Baker, who is a victim specialist with the FBI out of Kansas City. And she made Susan aware that there were victims of human trafficking, and she had already done many documentaries, and she shared that information with Susan and inspired her to look into this topic. And so Misty and many other survivors around the country are featured in this documentary, as well as other individuals. So we welcome you to come, and it's free. We want to share other information there at that event as well. So there'll be tables with information. We'll be able to social distance. There is a limit of 91. So you want to make sure you're one of those 91 people who can come and properly be social distance and wear a mask. But we appreciate that the Forum Theater is offering this venue to us for free. So that is our last announcement. Megan, we've never had so many people and announcements all in one meeting crammed together. But Megan, oh goodness gracious. I want to give you proper introduction as director of Polaris-operated U.S. National Human Trafficking Hotline. You've worked for the hotline since 2013, starting as a hotline advocate, responding to contacts to the hotline in both English and Spanish. In your current role, you provide strategic oversight of the program to ensure a survivor-centered and trauma-informed response. Megan leads a team of managers to promote consistency and continuity across the department, as well as to design, test, and refine innovative strategies and technologies to ensure optimal case response. Thank you, Megan Cutter.
Thank you so much for having me. I'm so happy to be here. And I'm actually so glad we did introductions, because it's helpful for me to hear about all the work that you all are doing and kind of how everyone comes to this issue and what brings people here to show up. So I have presentation and slides and all of that, but I'm also happy for this to be, you know, as informal as possible, as conversational as possible. So please feel free to pop a question in the chat and I can kind of pause and redirect and, you know, respond and we'll go from there. But I am so happy to be here this evening. And what I'll talk about today is the Human Trafficking Hotline, which is operated, as Nanette mentioned, by Polaris, which is a nonprofit based in Washington, D.C. And I always like to say this when I talk about the hotline, because I think that sometimes when we talk about this big national resource, it can be, I never want to lose sight of all the important work that's happening on the ground and the connection between things in communities across the country that that the hotline can connect into. So our goal is always to reflect in our referral systems and with the law enforcement that we report to, all the important work that's happening in communities. And so that when someone calls us, when someone texts us, that we can get them connected into whatever that network is, where they're located, that can get them the support they need, whether that's a safe place to stay or legal assistance, or I heard from a lot of you that you're helping, you know, getting survivors from one place to another to access services. So if it's something like that where the coalition can help, so the hotline is only as good as the information we have about the great work happening on the ground and our ability to connect into that. So I'm going to kind of start from the beginning, and I know this might be a review for some people, but first time hearing it for others. So I'll kind of create a baseline and then we can go from there, but please feel free to put questions in the chat. We can go to the next slide, please. Awesome. So the Trafficking Hotline is a confidential toll-free resource that's available 24/7, 365 days a year to support victims and survivors of both sex and labor trafficking. And so we can help anyone who either has experienced that or who is connected in some way to a trafficking situation, looking to support a friend, a family member. And then we can also work with community members who are concerned about something going on in their community and kind of want to talk through, is that trafficking? Is there a way that we can support the victims and survivors? Is this something that needs to be reported to law enforcement? We do a little bit of that as well. We are available in English and in Spanish from the advocates that work here in DC. Several of them are bilingual English to Spanish. And then if someone speaks a language other than those two languages, we can use teleinterpretation to connect with them and speak to them in their preferred language. So that's definitely an important piece because we do work with a lot of people who, you know, English is not their first language. And if you think about a moment of crisis that maybe you've experienced, it can be helpful to communicate in a language that you feel really comfortable in. So that's super important to us. I would note, I think we talked a little bit earlier about federal agencies. The hotline is funded in part by the Department of Health and Human Services, Office of Trafficking in Persons, which is the trafficking department within the Department of Health and Human Services. So they fund a portion of the costs of running the hotline. We can go to the next slide, please. All right, so there are lots of ways to reach the hotline. Probably the most commonly known one is the phone, but we also have a text line, which is a slightly different short code. Then you can web chat us, and all three of those first ones are things that you can reach 24/7 and you'll get connected directly to an advocate. We have a web form and an email address that are checked continuously throughout the day and night, but the response time is a little bit longer. It's not that immediate response. But those are all the different ways to get in touch with the National Human Trafficking Hotline. If we go to the next slide, we'll get into a little more detail. So over the years, we've talked to a lot of people. These numbers are from December 7th, 2007, which is the inception of the National Human Trafficking Hotline, through the end of 2019. So we haven't cleaned up all of our 2020 data yet, but as you can see, we've heard from people all different ways. And the bigger number is phone calls, but one of the interesting things, and we'll talk about this in a bit, is that text messages are our fastest growing mode of communication. So they're increasing at a higher rate than the other forms of communication, which if we think about how people communicate these days, definitely, makes sense. And also if you think about someone who's in a dangerous situation, text messaging allows them to be a lot more subtle than making a phone call. And it also allows survivors to choose the pace at which they talk to us. So one of the things that we can get into a little later is, calling the hotline is a hard thing for someone to call and talk about some of the most challenging things they've experienced. And on the phone, there's kind of this like implicit pressure to respond. No matter what kind of safe space we create for someone to talk, it's a back and forth. But with text messages, they can read it and they can say, you know what, I need some time to process, and then I'm going to text you back. So a lot of times our text conversations with victims and survivors go on for a long time as that person is kind of choosing a pace that works for them, which is totally cool. And I think that's a different advantage to texting that we don't always highlight. So I wanted to make sure to share that. We can go on to the next slide, please. And this, I think, is also helpful for you all to see, especially, those of you who are community members, but also who are involved with nonprofits or non-governmental organizations. Also, if you have victims or survivors in your life who you might be calling on behalf of, or if you yourself are a victim or survivor of trafficking, just to kind of see the breakdown of the top categories of people reaching out to the hotline. This is again from the inception of the hotline in 2007 through the end of 2019. So we hear a lot from community members, but then we also hear from other groups as well. And they're not shown here, but we talk a lot to educators, to hospital staff. I don't know if you folks are, I imagine some of you are familiar with Truckers Against Trafficking. We hear a lot from truckers who are, out on the road and seeing things at truck stops that they're concerned about. And so really anyone can reach out to us, but we really, if we go to the next slide, I'll show you a little bit about the increase in hearing directly from victims and survivors over time. And what I think is really impactful about this, and I think Nanette touched on this a little bit when she was talking about, doing outreach to illicit massage businesses, is that one of that pieces of outreach is just talking with people about their options and what choices they have, and that, if the business relocates to another state, you don't have to go with them. And that's one of the things that the hotline really believes in, is giving victims and survivors those choices about what they want to see happen next. Because as you all know, trafficking takes away power and control from the victim. And so we want the time when someone starts to receive help and support to be a time when power and control is restored back to them. So all of that to say, when we hear directly from victims and survivors, we can have that conversation with them about what they want to see happen next. We can talk to them about their needs. We can get them connected to resources that they're interested in. And it's important to us that they trust the hotline and that they trust that this is a resource they can connect with. And so we've seen this steady increase year over year in victims and survivors reaching out directly. And we see that as a show of trust, and also that, the number is being shared in the way that victims and survivors are seeing it and recognizing, oh, that could be a resource for me. And that might be, I know there's a posting law in Missouri to make sure that the number is posted in public buildings. So it could be that, it could be, if you all are doing outreach and sharing the hotline number, or if you, have someone in your life who you're concerned about and you say, here's a number you can text if you ever decide that you want help. Anything where we're building trust with the people who are most vulnerable and could most need this number is really helpful to getting them to reach out to us. We can go to the next slide, please. And I always like to show this slide because when I first started working for the hotline, I kind of thought it was like 911. I was like, I'm going to be doing crises all the time. But because the hotline can do so much, there are a lot of different types of requests that we receive. And the biggest one is for people who are calling to report a tip. And that might be someone calling about themselves. That could be a parent who has a missing child who they're worried is being trafficked and they want support with that. It could be a friend or a family member. It could be a trucker. And then a smaller portion is someone calling really just to receive connection to a service provider. And that might be shelter, case management, any of that type of stuff. About 7% of the requests we receive are crisis assistance. So we define that as when someone's need needs to be met pretty immediately. And that could be needing to connect with law enforcement because there's a high level of danger. That could be needing a safe place to stay that evening and not having anywhere else to go, maybe needing medical attention, emergency transportation, things of that nature. So although those cases are a smaller portion of what we work on, they take up a lot of time and resources, as I'm sure all of you with the coalition, have experienced that when you're working on getting someone those immediate resources. It can be a process of calling lots of places and figuring out what's going to work to meet the victim's need. And then you'll see these tiny little numbers for general information and for training and technical assistance. We do hear about those requests through the hotline itself, but we really ask people to go to our website if they have general information questions and things like that, just to keep the lines open for people calling or texting. See, I see a question from Theta. What should a citizen expect if they contact Polaris because they are concerned a business may be participating in labor trafficking? So this is a really good question. And I think if we go to, trying to think if there's a good slide to answer this, but I think maybe not, so I'll just answer verbally. And then I might give you more context later in the presentation. So it really depends on the situation, but depending on what you share about the business, there's a few things. If you happen to be in touch with any of the people working there and it's safe for you to share the hotline number with them or to have a conversation with them about, what are they looking for? Are they, looking to leave? Do they need support? What are kind of the conditions going on? If that's safe, which it's not always, but if it is, we would encourage you to kind of have that type of conversation. And if not, what we would do is take down the information and assess for a couple of different things. One is like, what are the level of trafficking indicators? Another would be, what's the level of danger to the people in the situation? And then we also want to think about what we call unintended consequences. So if we were to report this to law enforcement, what might happen to the victims and survivors who are in the situation? And would they ask for help if the police came, or would they say they were fine? Would the trafficker retaliate against them if law enforcement were to get involved? We think about all of those different kinds of things. And depending on the level of danger, the level of trafficking indicators, and all of that, we'll then move forward either to report to law enforcement, or if that's not something that we have enough information to do, we'll talk with the person calling about how can they pass the phone number along to the victim. What are some things that if they do learn that there's a high level of danger or high levels of control, it doesn't seem like the victims that are there are going to be able to leave, how to reach back out to us. So we'll make a plan with the person to make sure that they can figure out, what those next steps might look like. And labor trafficking can be really, really tricky, I think, because often victims in those situations they haven't always been given information about their rights. Often the level of threat is just as severe as a sex trafficking situation. So the level of fear that the person has is very high. And so what we've found and what we've heard from survivors of labor trafficking is that, getting help from law enforcement before they're ready has not always worked for them. And so we try to kind of find whatever that balance might be of providing support and all of that, and then also thinking through what the victim and survivor might want. The other thing I think that's really valuable to know, and I think this is on the next slide, let's see. Nope, that's okay. That I would also highlight is that because the hotline is a national resource, we also are able to aggregate the information we receive in our system, and say we receive like 3 or 4 reports about 3 different businesses maybe in the same state, but different cities, who are owned by the same person, and we're hearing that same pattern. If we're hearing about a pattern or a trend or increasing levels of danger that are a part of that, that might also be something that would push us to alert law enforcement and say, hey, we're seeing this concerning trend, and it seems as if there might be something going on here that's a little bit networked, or maybe there's a bigger issue here that is connected with human trafficking. And if things are happening across state lines, we can connect law enforcement from one jurisdiction to another, which is really helpful to make sure that they're not duplicating efforts. So that's kind of a long answer to your question, Theta, but I hope it helps. It really does depend on the situation, but those are some of the things we think through when we're making decisions about what to have happen next. All right. I'm going to talk a little bit about confidentiality And please, if you have questions, feel free to pop them into the chat, just like Theta did. That's super helpful. The hotline is a confidential resource, and there are a few exceptions to that. So one is if someone says, sure, you can share my information with a third party, I consent to that. Another is if someone threatens to harm themselves or someone else. We do have to report that to law enforcement. Another is if we learn about a minor who's being abused, neglected, or trafficked. We are mandated to report that, and we really believe law enforcement, are the right folks to intervene in that situation. And then the final is if we learn about someone in a imminent or life-threatening emergency, we will report that to law enforcement as well. And if it's a trafficking situation, the folks we're reporting to are trained in human trafficking and understand kind of the nuances of the crime. So we trust them to mitigate some of those unintended consequences. I'm just going to read this other question in the chat. If the workers don't speak English, we're hired by a company to do a service and you don't have the means to communicate with the workers, should you call Polaris? For businesses, contractors are supposed to let you know all workers on a job are performing services. So I think it would be worth calling the hotline, and that could be something that you could talk through with the hotline advocate, and they might ask you some other questions about the worker situation. And I think it's good to have that information in our system in the event that like maybe someone else has called about the same business, or maybe one of the victims has called themselves, and we can kind of put that information together to help with a more holistic response. When you say are businesses / contractors supposed to let you know all workers on a job are performing services, I'm not 100% sure what you mean by that question. Do you mind just clarifying, Theta?
Yes, what I'm saying is like when, let's say I was building something in my home and I saw some people come and I was concerned because of the way they were presented at the job. Something just didn't look right.
Yeah.
And you know what you're looking at, but you don't have the evidence to back what you're saying. Are there questions that you can ask of the person performing the job or providing the service so that you can know that all of the workers are legitimate and that they aren't being trafficked?
Yeah, I think that, and it does vary by state what the labor laws are, but I think that like something as simple as saying to the contractor or the business that you're hiring, like labor conditions are really important to me. And it's important to me that the people who work for you are being paid fairly and are working fair hours, and that, if they needed information about their rights, they could get it, that they have access to their documents. Like what we've really heard through the hotline is that like even just that education and the consumer saying, I know what rights workers have, can really be a deterrent, because it helps the business, like they know that someone's looking and they know that someone's paying attention. And often trafficking, especially labor trafficking, is a crime of opportunity where the trafficker doesn't think that people are paying attention, right? So that would be one like tangible recommendation. And then also if you've got workers in your house or in your business, like you could bring everybody water one day, and when you give them water, you give them all the hotline number and you say, hey, if you ever need help, or and you could even frame it like someone in your family or in your community or at your church needs help, give them this phone number. I think Polaris just moved to a new office last year, and one of the things we put in our contract with the construction workers was we had to be able to do these like know your rights seminars with the workers. I think we did once a week throughout the summer. And we framed it as both their job working with us on the office, but also, hey, you're out in your community with other people who are working in construction, and we know construction is a place where people get labor trafficked. This is a resource that can help. So I think those are all things that I would suggest, and even just asserting that can help deter someone from trying to kind of put that past you, especially in a place where you're the consumer. Good question. All right, next slide. Thank you. So given all those, not all those, just the 4 exceptions to confidentiality, and one of those is highlighted in this last willing to be contacted bullet, people also do have the choice to be completely anonymous. They don't have to tell us who they are or give any contact information, or they can tell the trafficking hotline, here's who I am, here's my phone number, but please don't tell law enforcement please don't tell a service provider. I want to be confidential for now. And we've really found, particularly with individuals who maybe are and have a legitimate fear of talking to law enforcement, or who have a history of not having positive interactions or trusting law enforcement, that this middle confidential option is a really good way for the hotline to sort of play the middle person and facilitate that report while the reporting party feels safe. And sometimes what we find is that law enforcement will come back and say, hey, I'm agent so-and-so, and I'm a victim witness specialist, and I really want to I'm working on this case. Do you have any other information? And in that situation, if we have the person's phone number, we can call them back and say, hey, there's a specific individual who's taking interest in your case. Would you be okay if we gave them your phone number? And then they can say yes or no. But especially if someone has been reporting the situation to law enforcement for a long time and hasn't gotten a good response, or even has been told, we find this a lot with like substance abuse, like especially someone who's trying to get help for their adult child who, maybe is in their early 20s struggling with substance use, law enforcement often will say, oh, that person, law enforcement who aren't trained, that person's just involved in drugs, like they're fine, they don't think they're being trafficked, or they want to be there. And so sometimes the parent will say, I want to report, but I'm not comfortable. I don't want to have that conversation again. And so then when law enforcement calls us back and says, we really want to talk to this person, we start to rebuild that trust, and we're able to say, there is a specific person who wants to work on this case and they would like to talk to you. So that doesn't always happen, but sometimes it does. And so that's why that middle option is something we always make sure to offer people. But these are always choices for anyone calling us that we offer, so that they can make sure that they know what their options are. I'm wondering, with time, do you all want me to talk about, I can talk about data and statistics. I can talk about what to expect when you call the hotline a little bit more. I can open up to questions. I just want to be thoughtful of everybody's time. I don't know, Nanette, if you have a preference.
I don't. Would it be helpful to know more about what to expect with calls, maybe more importantly, because I know you have a lot of statistics on your website, and even state specific. There's even, I think, information sent out from Missouri, but maybe a little bit more about what to expect. But anyone on the call here, we've got, I don't know if anybody sent anything in chat. Yeah.
Yeah, sounds like Kate's saying what to expect.
Yeah.
Okay, cool. We'll keep going with that, and then we can talk about statistics if we have time. Thanks. All right, next slide, please. Okay, so the first thing that happens when you call a hotline, and this is relatively, this is about 2 or 3 years old. So if you called before that, this is sort of new. Our volume of incoming calls is very high, and it has been increasing every year. And so one of the things we implemented is called an interactive voice response, IVR, which is just when you call somewhere and they say, press 1 to do this, press 2 to do this. And the reason we did that is because we want to be able to prioritize people calling with an immediate need and survivors and victims who are calling about themselves and want to get out or need immediate help. So that has helped us be able to manage the volume a little bit, especially if someone's calling about something non-urgent and maybe has a little more time to wait. If there's a survivor who's calling about themselves in that moment, they get bumped to the top of the line. So if we go to the next slide, it'll talk a little bit more about that. So when you call, after you select your language, you'll hear these 4 prompts. And then a new one that hasn't been added to this slide yet is that for press 4, if you suspect that you have witnessed or observed a situation, we now have a button that's, if the situation you're observing is happening right now, you can hit that and you get bumped up to the top. So that was something we heard particularly from truckers, where what they were reporting didn't need to go to 911, but it was happening in a pretty time-bound specific moment, and they wanted to make sure that they got in touch with us in that time. So that's what you'll hear. And then if we go to the next slide, you'll get connected with an advocate. And their first thing that they're going to talk to you about is going to be safety. And the reason for that is just to make sure, because we do talk to a lot of people who are calling us who only have a limited amount of time to talk, or their communication is being monitored in some way. We ask everyone, are you safe to talk right now? And even if the answer is yes, I'm safe to talk right now, once we understand who's calling us, we might talk a little bit more about the safety piece of how long do you have to talk to us? making sure you delete the number from your call record, making a plan to call us back safely, all of that. If the person calling us is in an active trafficking situation, we're going to spend a lot of time on safety. But if we confirm, you know, you're a community member or you're calling on behalf of someone else, but you're safe, we'll start to talk a little bit more about how urgent is your request? What are you hoping we can help you with today? And there are a couple of buckets. The two big ones are you looking for support reporting something to law enforcement? Or are you looking for referrals to a trafficking specific service provider in your area? And so we'll explain those two things. And then there's kind of this middle ground that particularly for friends and family members of people in active trafficking situations, we spend a lot of time talking about safety planning, talking about how to safely get the phone number to the victim or survivor and how to be a support system to that person, so that the victim or survivor knows, you know, when I'm ready to reach out, when I decide I need help, that person as a support system is still there and they're not judging them and they're not, you know, I think particularly the judgment is something that we hear about a lot. Great question. Have you received an increase in call volume due to the COVID-19 pandemic? Nanette and Loretta, if you go all the way to the end of this slides, we have a couple about COVID. So what we found is that our volume has increased slightly, but particularly in the very beginning of the pandemic, we looked at, if you go to that past slide, we looked at, this is perfect, thank you. We looked at 3 periods. One was what we called pre-shelter in place in 2019, so like as a control. Then we also looked at right before a lot of places had a stay-at-home order. And then we looked at the month of April 2020. And what we found, if you go to the next slide, is that although our call volume remained more or less steady, and so did our text volume, that the type of requests we were getting were different. More than 40% increase in crisis cases, and then of those crisis cases, the requests for emergency shelter nearly doubled. So we know that people are having more urgent needs. We saw this a lot in April and in May, and things have sort of, I don't want to say gone back to normal, but people have found maybe a little more stability in this time, and we're finding that it's kind of evened out. One of the things that Polaris is analyzing right now, and we hope to be able to share in the next few weeks, is there any change in the type of trafficking? So we're hearing a lot from survivors that a lot of things have moved online, or that if they were involved in street-based commercial sex, it's moved to hotels, things like that. And we're interested to see if Hotline data matches up with that. Hotline data is useful, but it also has some limitations. It's not, you know, it only reflects who's comfortable calling us, who has our phone number, who feels safe calling us. So there are limitations there, but it can be an interesting sort of window into what's going on. This report is on our website, and I can just not Slack, this is Zoom, whatever platform we're using tonight. I can put the link in the chat so that everybody can access that. Let's see, I saw another question in the chat. How do your staff know about local resources? Is our information listed on your resource list? All that you need to know what we can do locally. This is such a good question, and Nanette and I actually have been talking about this week to make sure that our system reflects all the great stuff that you all do, and also that we know about the providers on the ground in Missouri. So Hotline advocates, which are the staff that respond to incoming texts and calls and emails, they have a database that they use, and they'll pull up a city and a state, or even just a county or a state, and then they'll say, I have an adult, oh, thank you. An adult victim who has experienced sex trafficking, who is a US citizen. And then maybe they need emergency shelter, but they also need support with mental health services. They can put all of those filters in, and it'll pop up with some options. And then it will also show the types of services that are available. So one of the things Annette and I have been working on is making sure that the account for the coalition is totally updated. We have and if anyone works with other direct service providers who serve trafficking victims who you want to make sure are included in our directory, I can give you my email and I can connect you to the person on my team who does that piece. But our work is really only as strong as if we're reflecting all the good work happening on the ground, because we want, when advocates search that city and state or that town and state for the options to come up. And so some places have a statewide response. Some, like Florida, is really county by county. And so we always try to talk with the people on the ground to get a sense of what does your anti-trafficking response look like? What are the resources? Maybe even like what are the gaps? Where are the areas where you need to rely on domestic violence services? Or maybe there's great resources for women, but not for male identified people. Maybe, you know, there's a lot of options for US citizens, but not foreign nationals or vice versa. So that's another thing we try to reflect in our system. That's a great question too. I think we could go, I'm trying to think about in remaining time. Does anyone have other kind of questions that came up from that, or I could do 1 or 2 more slides? All right, maybe if we go back to, let's see, a little bit further to some of the what to expect when you call the hotline. Oh, here's the referral directory stuff. So if you go here, that's perfect. So there's a version of the referral directory that our advocates use, which is internal. And the reason for that is not all providers want their information shared publicly, or they have a 24/7 phone number they want us to contact that isn't for the general public. So that's what the advocates use, but then a version of that is available online at humantraffickinghotline.org. And that's a great place to start if you are looking for kind of general referrals for someone, or you just want to get a sense of like what's available in other states. And that contains just anti-trafficking specific providers. But in our internal database, excuse me, we also have related issue providers, because we know that in some areas, like I'm thinking of places like Montana or Wyoming, where there's these big rural stretches, and other states like that, where maybe it could be hours between one resource and then the next. We always try to have some of those related issue resources too in an emergency, and then we'll get the person connected to trafficking resources as soon as we can. Yeah, if we go maybe to the previous slide, I'm trying to remember all the different. Oh, this is good. So these are some of the questions. Some piece of feedback that we sometimes get that I want to make sure I share with you is people are like, I call and you ask me all these questions. And we really try to ask questions about referrals that are specific to what is needed to get someone connected to the right program. And then if they are interested in reporting to law enforcement, that's going to be a much more detailed call, because we need information that law enforcement can act on, like phone numbers or social media handles or things of that nature. Let's see, I'm going to read what's in the chat. Are victims of human trafficking who have been recovered able to get access to COVID-19 resources? And do you mean like resources for, Erica, do you mind telling me a little bit more what you mean so I can answer your question? Testing. Yeah, that's been one of the big challenges. And I'm sure Nanette and other people on this call have seen this too, is that when someone's been recovered from a situation, in order to get into a shelter or a safe place to stay, they often need to get tested first, and then they might have to quarantine or things like that. So that's been a big challenge. And sometimes when survivors are interested in relocating home, maybe they've been brought from their home state to another place, they have to, make sure to get tested or quarantined before they relocate. And this is such a good question, Erica. So the quarantine piece is really difficult, and some providers, it looks different across the United States. Some people have parts of their shelter, or they have multiple shelters and they've designated one as a place where people are quarantining. Some providers have hotel vouchers and things like that they're able to use to have people in a shelter, or in a hotel rather, until they get a test result back. And I don't know much about vaccines yet. I hope that I've seen some things, at least in DC, for shelter residents. They're higher on the list for receiving the vaccine. So I'm hopeful in that sense as well. But that's definitely, been an added barrier. Peter. Special visas for victims of trafficking. Are they good at making the reportable if comfortable? So special visas for victims of trafficking, we have seen, so there are two. One is specific to trafficking. It's the T visa, which is for foreign national survivors of trafficking who are open to working with law enforcement to investigate their situation. The other visa that's a little bit more broad is the U visa, which is generally for victims of crime. I think that it really depends on the law enforcement or victim specialist who's working with the victim in terms of how comfortable they can create an environment for reporting. And I think it depends on what the victim's experience is. If they've had good experiences with law enforcement in the past, or if the country that they come from has a strong rule of law and they maybe trust the government, they might be more open to reporting. We've seen kind of all varieties of that. So sometimes there's a lot of support around helping a victim feel comfortable reporting for the purpose of a visa, and sometimes it's a little less. So that's kind of a wishy-washy answer to your question, but it does really depend. Erica's asking about what services pay for the hotel services when they quarantine. This is a great question. So sometimes it's the service provider themselves. So whoever that is that's also helping with the shelter or other things. Sometimes some cities have like COVID-19 relief funds that they use for hotels for people who don't have permanent housing. Sometimes it's like private donations. It's really varies depending on where the person is. And some places have more support than others, which can be really challenging. Okay. I do want to be really thoughtful about time. I know I keep saying that, but I especially with Zoom, I feel like it's easy to go on and on forever. But what I'll do, I'm going to put the COVID research just in the chat, and then I'll put my email address as well. I definitely am available to, if you have any questions or concerns or things you're wondering about, please email me. My virtual door is always open, and it's really important. What I always say to people they say like, oh, isn't working on human trafficking really hard? Isn't the job of hotline advocate really difficult? And yeah, it can be difficult. And I'm sure you all have seen really challenging things in your own work. But there is also this piece for me that motivates me to keep doing this, is both serving victims and survivors, but also this collaboration, right? Of seeing what you all are doing in Missouri and how it connects to the work I do in DC and how that connects to what people are doing in other states. And so I think that like when we get good people together who want to make things work and want to figure out how do we get this survivor from point A to point B, I really believe, maybe I'm naive, but I try not to be jaded yet, so we'll see, is like, I think we can make change. And so I'm just grateful for this opportunity to talk with all of you. All right, let me find that link, but I'm gonna be quiet for a sec.
So Megan, just because I know, and I think we're all hanging in there, we know we're a little bit over, but it's okay. If we could just, out of respect for you and the presentation, just at least click through the slides. So if there's anything you want to highlight, just to at least take a second to go through. I don't know where we are, but if you just, okay.
Sure, let's see. Go forward one more and then one more. Awesome. So I went over this a little bit already, but once you get to a hotline advocate, they'll triage, they'll assess for safety, and then this needs piece is when they're going to say, are you looking to report to law enforcement? Are you looking for service provision? And if someone, like, for a lot of people, those words are like, I don't know what that means. And so a big part of the hotline's role is helping people understand and navigate the systems that can support them and that can provide help. So we're really explaining, if you want to leave your situation, we can help you find a safe place to stay. We can get you legal assistance. What are your biggest concerns and how can we help you address them? And then with law enforcement, talking about what reporting to law enforcement might look like and what might be really helpful about that and what might be challenging about that. And so kind of preparing people for those things and then allowing them to decide what they want to see happen next. And then where it says trafficking, this is where we're going to ask a little bit about the trafficking situation, and how much we ask is really dependent on what the person wants. So like I mentioned earlier, it's going to be more in-depth questions if they're interested in reporting for the purposes of getting what we need. It's going to be a little bit less for connection to service providers, because once we connect them to whoever's going to provide that help on the ground, they're probably going to have to do an intake and answer a lot of questions about their experience, and we don't want to, you know, ask them those things twice. And this last arrow is response. This is making sure that once we have everything we need, that we get them connected to the appropriate resource, or that we get the report out to law enforcement. All right, next slide. And this is just what happens after the phone is hung up or the text message is over. We assign the case either to be urgent or non-urgent. And urgent is going to be really anything that either needs to be handled. There's like a 0 to 2 hour frame, and there's a 24-hour frame. And anything within there goes right to the supervisor on shift. And we have a supervisor available 24/7 to help with that and make sure that, okay, we've got this information, here's what needs to happen next. And then if it's non-urgent, you're popping over to step 4, where this team called the case response specialist, they're reviewing things that are less time sensitive, but still need to be reviewed to ensure that they're accurate and that the person calling us has what they need. And kind of in tandem with this, part 3 is happening, where the hotline advocate is entering information in our database to make sure that, you know, the next advocate who comes on shift, if that person calls back, we know what happened, we know what they asked for, so someone doesn't have to repeat themselves. And then this 5th step is the follow-up actions that I mentioned in the last slide, this response piece of how do we actually do what the person is asking for. Next slide, please. Crisis response, I think this is helpful to hear because, as you saw, those crisis requests went up 40% right after the stay-at-home orders were put in place. And so that can look like any of these things on this list, and it can be a combination. So it's really based on what the person calling us is looking for and what their most immediate need is. And one of the most important pieces is creating a follow-up plan to make sure we stay in touch with that person until they're connected with what they need on the ground. Next slide, please. I feel like I've touched on a lot of these already, but this is kind of an aggregate of why use the National Human Trafficking Hotline. I think that there sometimes can be this kind of, you know, it's challenging to decide to use a national resource when there are great local resources. And so what I always try to emphasize is that the hotline can be a value add to what already exists on the ground, and that when we tap into that network, we all can work together and make sure that victims and survivors have what they need. So
which speaks to the partnership that the Missouri Attorney General's office is having, that we used to have a hotline, but we've eliminated that and having everybody use the national hotline number.
Yes, great point.
Yeah.
And that means that all of these things on this slide are happening for you all in Missouri through the trafficking hotline, and then that we're connecting with the Attorney General's office on tips when they come through and making sure that they know about them, and then we're connecting with whoever the right service provider is on the ground. And I think I've talked about most of these already, so we can go to the next slide. We've talked a little bit about questions, but just to you know, let folks know that we do ask pretty detailed questions, and it really varies based on what the person is asking for. And we really try, our advocates are highly trained, and they receive over 80 hours of training before they start answering the hotline, and then they receive continuing education throughout their employment. So we're always trying to make sure that they're asking the right information, but that also they're asking for enough information and not too much, to kind of find that balance where you're not re-traumatizing someone, but you're understanding the situation to the best of your ability so you can help them. Next slide, please. All right, I should have gone to this when you asked your first question, Theda. I forgot I had this slide. So when we're talking about someone reports something to the hotline and we're trying to decide, you know, should this get reported to law enforcement or not, we think about a bunch of things, but these are the top factors that we're weighing against each other. And safety concerns and child abuse or endangered minors kind of go over everything else. If those things are present and they're severe, we've got to get this to law enforcement. Everything else, and age of the victim will change that too. The other pieces here all kind of are different parts of the puzzle, that sometimes we have all the pieces, sometimes we have 5 of the pieces, sometimes we have 2. And so the supervisor team and the case response specialist team are looking at all these pieces to say, okay, is it going to be safe for the victim or survivor if we report to law enforcement? Is it going to help them get what they need, or is it going to potentially cause more harm? Is this person ever going to have another opportunity to reach out to us? Is there a person in touch with them who can continue to kind of get a sense of their safety? And so looking through all of these things. This is not available on our website, but I'm happy to share the slides with you all, or have Nanette or Loretta do that. It should be on our website soon. We just updated it. Next slide, please. And this is, I think, always the hardest slide to deliver. So I'm actually glad we got to it, because sometimes one of the big questions we get is, why don't we report everything that comes through the hotline to law enforcement? And there are a couple of different reasons. And I think the one that the bottom two, the victim's wishes are unknown and there are high risks for unintended consequences, or that the adult victim doesn't wish to report, those can be the most kind of uncomfortable for us as advocates to sit with, because when we get into this type of field, we often want to help. And sometimes it can feel like the way to help is only through law enforcement. And what I've learned from law enforcement that I've worked with over the years on the hotline, what I've learned from survivors, is that when an adult in particular is not ready to leave their trafficking situation, often they are going to say no to the help from law enforcement when it comes. If they have warrants on their record, they could get arrested for another crime. If the trafficker suspects that the victim is the person who called for help, even if they're not, the victim could get retaliated against and be hurt, or their family could be hurt. There's a lot here. And so this is a big thing that we wade through on the hotline every day. And I'm always happy to answer questions about this, because I think that on its face, it can feel like, oh, like, well, I'm calling because I want to help. And so a piece of what hotline advocates do is help people think through these different factors and explain, what are some other ways we can support someone? And maybe that's through safety planning. Maybe that's through, particularly for someone who's in direct contact with the trafficking victim, creating that safe space so that when the victim is ready to leave, they know who to reach out to. All right. Slide. Just explains the referral directory, which we've talked about. And I think we've talked about this. I think we are good. And then everything else after this is statistics, which are available on humantraffickinghotline.org. But that sheet that Nanette sent around before the meeting has kind of a summary of Missouri statistics from 2019. And the caveat always is, it's a snapshot of what we heard through the hotline, but it doesn't reflect the extent of trafficking in Missouri. Like we talked about earlier with missing persons, when we're talking about any crime, only so much of it is reported, only so much of it gets surfaced. So just be aware of those limitations, but I think it can be a good place to start.
And that's, Megan, it's such an important point, because for 13 years now, we've talked about this hotline, and we want people to know that the numbers are limited. It means, like you said, people who are calling, people are texting, people are emailing, but it is the best thing we have.
It is.
And we appreciate that. And so to acknowledge the limitations, but to also appreciate that that is the best thing we have going for our country in terms of having any kind of numbers, and to look at how it changes, and the reporting and the types of trafficking, and that you as an organization and all of the people are working have evolved with this issue to be more responsive, to be more comprehensive, to be more effective, more efficient, and all those things. There's so much that have changed that I hadn't tuned into, even though we've been talking about this number for 13 years, so much that I can appreciate in this presentation myself personally, even though I'm a boots on the ground person. I really appreciate it. And so I think there's, especially now that we are confusing Missouri with two different numbers, we should all have that toll-free number. We should all be willing to call it, and to know that the Highway Patrol for Missouri is really closely tapped into when those calls are made to the hotline. And we have boots on the ground throughout Missouri because of our troopers. So let's not be hesitant. I know in the history of the 13 years, there's been different people say, well, I called and I didn't really, and but we're in a different place in time now. I think this is a field that we have to really keep working hard at, being very aggressive, being very intentional. And I appreciate, Megan, what you shared about this. I see that that's happened within the National Human Trafficking Hotline organization.
Yeah. Well, thank you all for having me and for being open. I'm just going to put my email
Okay.
in the chat.
And while she,
Thanks, Rita.
yeah,
Thanks, Rochelle.
yes. So just recently we had someone who was texting my phone who was in a very precarious situation. Actually, she was in a crack house and the trafficker, lots of drug use. So again, appreciating with what we're doing directly with survivors and seeing the capacity and hearing the capacity that you all have as well, because those are all necessary, whether you're answering a national hotline number or somebody's calling you directly locally. All those steps are so critical. All of those access to resources are so critical, and that sensitivity is so critical. So what Loretta has up on the screen is going to have on the screen is our state Department of Public Safety trafficking hotline number poster. This was passed in 2018, House Bill 1246. And please encourage you to go to not only Polaris's, the National Human Trafficking Hotline website, but also to our Missouri Department of Public Safety Human Trafficking page. It also gives you all the places where that poster should exist and be displayed. And again, appreciating a representative person for bringing legislation that will increase the education that goes on. Posters one thing, education is another thing. I will put a plug in for this, that we've talked on this other Zoom meetings about the fact that there are some states that have required education in the school systems at a state level through state legislation. And maybe that's something to strive for in Missouri's future, because the education of our youth, the prevention that comes from the education of our youth is so critical. So everybody should have that number in their head, in their phone, sharing it, knowing it, and have confidence with the personal presentation that we've had from Megan today. Any other comments or questions from folks? Anything else in the chat box? Wow. Thank you, everyone. This has been, I think we recorded. So if anybody needs this after, that's why I appreciate going through all the slides so that people who weren't here won't go, wait, where'd it go? They quit at 7:30. Where's the rest of it? So thank you, everyone. If there's not any other comments, make sure you follow us on Facebook, sign up for our email, help@stophumantraffickingmo.com to continue your RSVP to participate in the meetings, to know about the announcements of our January 28th documentary screening, of the January 26th virtual event hosted here for Missouri's 6th annual Human Trafficking Awareness event. And again, next month, the first Thursday in February, our guest speaker will be talking about Missouri legislation and what we have already going on, enhancing further what we've learned about today from Representative Person. Thank you, everyone. Thank you, Megan.
Thank you.
Yes, good night. Be safe, everyone.
Thank you.